Welcome. I like to talk about prostate issues. There's two separate entities. I'm not going to go into the deep physiology. I want to go into the nuts and bolts on practical things that you can do right now at home to help yourself feel better. Scientifically, we can do that in another video. We have benign prostatic hypertrophy or hyperplasia. That's basically meaning that the prostate's getting bigger. I'm going to touch on that in just a second. And the other aspect that most people are having, particularly men, obviously over the age of, I would even say in the 30s today, is prostatitis. More non-bacterial prostatitis. Very few people have acute bacterial prostatitis. That is obviously something you need to treat immediately. With antibiotics, you're going to have fever, you're going to have lots of pain, burning. But in general, the average male who just gets testicular, aching in the rectal area and obviously affecting your stream when you urinate, frequent urination, people, because of the fact that the urethra goes through that little walnut-sized prostate, and when that prostate's inflamed, it starts to compress on the urethra and obviously can affect your stream and that urge and other symptoms that you may be having. Now you're looking at someone who had prostatitis in the 20s. I've been to many different urologists, internists. They would always check my blood for my PSA. My PSAs were always within normal range. What do? They just wanted to treat me with antibiotics. Non-bacterial prostatitis with antibiotics. That is the golden rule, how they do it, because they don't know how it works. But in certain conditions, and many people who have these problems, it seems to ease the symptoms, but never gets to the root of the problem. So I want to hopefully try to get to the root of many of these issues and be able to change your diet in a positive way, as well as supplement specific herbs and vitamins, that can really make a huge change. So you can live your life happy, have less pain, have better encounters with your mate, just everything, sleeping attitude, taking you out of that depressive state. It can really do wonders to the mind. When we're not working good down there, it seems like the whole world is collapsing on us. So I really hope that you find this video enlightening as well as educating. First, let's talk about BPH, benign prostatic hyperplasia. That's basically meaning enlargement of the prostate, and every male, one time or another, as they get older is going to have some form of hypertrophy. Although with all the people who have hypertrophy right now, not all of them are symptomatic. So we want to find out those things that you're doing or those things you need to stop doing that can get you asymptomatic, where you can start feeling well once again. Most people who have hypertrophy can be anywhere after 35 or 40 years of age. Obviously a family history of this, possibly even type 2 diabetes, as well as lacking physical exercise. Erectile dysfunction. There are many different factors, and they still do not know all the reasons why this occurs. Now, obviously, dihydrotestosterone is another thing I want to talk about. Dihydrotestosterone, known as DHT, is derived from testosterone. Testosterone is a hormone present, obviously, in both men and women. Testosterone gives us that deep voice, increase the hair, the muscle mass, the growth of the testicles, and how sperm produces how it begins. It actually changes how the fat is stored around your body. When DHT is present, that percentage amount, it can affect two things. 1. It can cause hyperplasia, making the prostate grow, and it can lead to baldness in men. What happens is when DHT is freely floating through your bloodstream, it links onto the receptors of your hair follicles in your scalp. It causes them to shrink and become less capable of supporting a healthy head of hair. So you're probably asking, what causes the prostate to enlarge? Well, check this study out. I actually have two different ones I'll share with you. Look here. This says hyperglycemia and insulin resistance and the risk of BPH. LUTS, an update of recent literature. Basically what they're stating here is that BPH, as we said, is benign prostatic hyperplasia and LUTS is lower urinary tract symptoms. And they're stating that when insulin levels are too high, that's when the cells start to multiply and grow. And look at this study in PubMed: diet-induced hyperinsulinemia as a key factor in the etiology of both benign prostatic hyperplasia and essential hypertension. I'm not even going to go into the hypertension part, but I will tell you that increased glucose in our system